Hey everyone, welcome to Simba Scholars. Today we are going to knowing about the lecture Health Assessment. Firstly, we see the introduction to health assessment. Here are objectives. Let's see. At the end of this session, learners will be able to know about basic medical terminologies, determine the basic concepts in health assessment, identify the types of health assessment, document health assessment data using a problem oriented approach. Firstly, we see the definition about health. There is no consensus about any definition of health. There is knowledge of how to attain a certain level of health, but health itself cannot be measured. Nightingale defined as health as a state of being well and using very power the individual possesses to the fullest extent. It is a state of complete physical, mental, and social well being, and merely the absence of disease or infirmity. Health continuum. It describes health states and allows health to be placed on continuum from one's optimal level wellness to a maladaptive status illness. Wellness is a dynamic process that is very changing. The well person usually has some degree of illness, and the ill person usually has some degree of wellness. Highest health potential, then good health, then normal health, mild illness, illness or poor health, critical illness, and then death. Dimensions of wellness. Number one, environmental. Number two, occupational. Number three, intellectual. Number four, spiritual. Number five, physical. Number six, emotional. Then last one is social. Well-being. World Health Organization. According to World Health Organization, well-being is a where each individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. The highest possible quality of life in its full breadth of expression, focused on but not necessarily exclusive to good living standards, robust health, or sustainable environment, virtual commitment communities, and educated populace, balanced time use, high level of democ- democratic participation, and access to leisure and culture. Disease, illness, and sickness. Number one, disease. Alternation of structure and function of body, known as disease. Illness. A response a person has to a disease, known as illness. Sickness. It is the individual per- perception of its illness. We will say its sickness. Thus, it is possible that a person has a disease DM, has hypoglycemia sometimes, but still feels that he is normal, so thus does not feel sick. Assessment. It is it is gathering of information to have all the necessary puzzle pieces to make a clear picture of the person's health status. We will see the definition of assessment. Assessment is the deliberate and systematic collection of data to determine clients' current and past health status, functional status, and to determine clients' present and coping pattern, Health assessment. Health assessment is an organized, systematic system of human body which involves the use of one's senses to determine the general physical and mental conditions of the body, but, but by collect- collecting both subjective and objective data. Basic concepts in health assessment. Number one is assessment. Number two, techniques to examine. Number three, health history. Number four, systems physical examinations. Number five, documenting findings. Number six, identifying abnormalities. Objectives of health assessment: surveillance of health status, identification of occult disease, screening and follow up care, the periodic assessment at regular intervals, increasing client participation in healthcare, accurately define health and risk care needs for individuals. Client must share in decision making for his own care. Purposes of health assessment: gather data, identification of nursing diagnosis, make clinical judgments about client's health status to evaluate outcomes of care, a routine screening, admission to a hospital or long-term care facility. What happens during a health assessment between a patient and nurse? Establish the nurse-patient relationship, gather data physiological, psychological, cognitive, socio-cultural, developmental, spiritual, identify patient strength, identify actual and potential health problems, establish a basic for the nursing process. Types of assessment. Here are types of assessment. Number one, initial comprehensive assessment. Number two, problem focused assessment. Number three, emergency assessment. Number four, ongoing partial assessment. Initial comprehensive assessment. This involves a detailed history or physical examination performed at the onset of care in a primary care setting or an admission to a hospital or long-term care facility. Problem-based focused assessment. It involves a history and examination data limited to a specific problem or complaint. This type of assessment is most commonly used in a walk-in clinical or emergency department and OPDs. Emergency assessment. This involves a rapid assessment during life-threatening or unstable situation in order to save life. Ongoing partial assessment. It is frequently performed on ongoing basis to monitor and evaluate the patient's progress, intervention, and response to treatments. Episodic follow up assessment. This type of assessment is usually done when a patient is following up with a healthcare provider for previously identified problem. Number two, shift assessment. When individuals are hospitalized, nurses conduct assessment each shift. The purpose is to identify changes in a patient's conditions from baseline. Number three, screening assessment. It is a short examination focused on disease detection. It may be performed in a healthcare provider's office or at a health fair. General guidelines for physical assessment. Number one, instrumentation. Number two, positioning. Number three, draping. Number four, preparation of the environment. Number five, patient preparation. Number six, techniques of physical assessment. Don't forget reviewing general information. Number two, introduction to client, which one is the basic and major component of health assessment. Number three, cultural awareness. Number four, obtaining the health history. Number five, pain assessment. Number 6, holistic approach. Documentation of HA findings, specific, avoid vague terms, concise, use short simple words, complete entry with date and sign, describe observation clearly, use standard abbreviations only, record exact size, position of lesions, use illustration, use critical thinking. Thank you, students.